WGN investigates kids left in limbo. As part of our ongoing reporting on the Illinois Department of Children and Family Services, we found children are being forced to remain in treatment facilities longer than is medically necessary.
And investigative reporter Ben Bradley has more on what he uncovered.
If you've ever been in the hospital, you know one of the most frequent questions asked is, when can I get out of here? Well, for hundreds of kids in DCFS care, many receiving psychiatric treatment, the answer is your treatment is complete, but you have to stay because we have no place to put you.
I got taken from my parents, my real parents, when I was 3.
Morgan is a rarity, a former ward of the state willing to talk publicly about her experience with psychiatric hospitalization.
First time I was like 14 or 13. I was scared out of my mind. I'd never been hospital. I didn't even know there was a hospital for I didn't even know I had a problem. I was just an angry child. I ended up in the hospital because I didn't want to go back home. I never liked being home, so I always ended up getting hospitalized because I refused to go back home.
To the foster home?
Yes, to my foster home. And my foster parent, when she realized that I didn't want to come back home, she was just like, take her.
And so began an odd odyssey through DCFS's system of treating kids for mental health issues. In Morgan's case, she said she had bipolar disorder and anger issues.
You know, you're only supposed to be there for about a week or 2 weeks. I was there for 3 months almost each time, and I went to the hospital like 3 times.
And for kids in DCFS care, it's not uncommon to languish in hospitals longer than doctors say they need to be there. The Cook County Public Guardian's Office analyzed state stats that show in the last year, 356 kids statewide were hospitalized beyond the time it was medically necessary. The average stay, 55 days, longer than a doctor deemed appropriate. And 18% of the kids were 10 years old or younger.
And they didn't have anywhere to place me, so I had to stay there longer and longer and longer.
The ACLU of Illinois and the Cook County Public Guardian's Office have been hammering away at this problem for years, but it's only gotten worse. 75 kids in DCFS care were hospitalized beyond medical necessity in 2014, 168 the following year, up and up to the 356 kids in the last fiscal year.
We need appropriate resources devoted to building the system of mental and behavioral health care services that children in this state need. We don't have it right now.
So what happened? We found an explanation at the Cook County Juvenile Justice Center, where Judge Patrick Murphy grilled a DCFS official during a hearing on behalf of some of the kids. The official said DCFS has closed 460 residential beds in Illinois since 2015. The plan was to replace them with therapeutic foster homes, but DCFS opened less than 30, and only 10 of them were in Cook County. The judge writing, witnesses implied that in hindsight, this was a mistake.
What do you say to these kids who are being hospitalized longer than they should be, than the doctors say they should be, because you've got no place to put them?
Well, I think the number one answer to those kids, and we do talk to those kids, and we do talk to their families about how much we care and love and support those children, and how we're working aggressively with community providers to build out resources for them.
DCFS Director Mark Smith has faced criticism.
In recent years, we have enhanced 613 residential bed options for children.
Not just for keeping kids hospitalized longer than necessary, but also after a series of WGN Investigates reports that expose the agency has so few emergency placements, 129 children spent the night in a state office or private agency room not licensed as shelter space last year.
Are we at a place where there's an answer and we fix it? No. But what we are committed to doing, and what my administration is committed to doing, is to keep growing our residential, therapeutic, foster care facilities, and we will keep driving that forward.
This is a nice neighborhood that I live in now, but...
Now, 19 years old, Morgan is on her own, working, and she says, in a far better place.
Even though it was an experience to go through and it was hard to go through, instead of being mad at the world and especially at DCFS, I learned to use them as a tool. Do what I need to do so I can be where I want to be.
Keeping children and teens hospitalized beyond what is deemed medically necessary isn't just costly to the kids. There's also a real cost to taxpayers. That's because Medicaid doesn't pay for the extra time and treatment. The Cook County Public Guardian's Office estimates it wastes at least $6 million a year, money that could go to paying for proper placements. Ben Bradley, WGN Investigates.